So good afternoon. I'm Allison Pike. I'm a physical therapist here at Spectrum Orthopedics. Today we're doing a video in regards to golf assessment and golf rehabilitation. Over the years I've taken 3 different courses in golf assessment and golf rehabilitation. So this video may morph a few of those together. Primarily though, this is based on the golf assessment program called Back to Golf through Pebble Beach in California. So a couple of things that we look at in golf assessment, and number one, there's different reasons why we would do a golf assessment or golf rehabilitation. Golf rehabilitation obviously would be if somebody's injured and they're needing to get back to golf, but we don't always see people when they're injured. We would see them if they just want to improve their golf game, if they want to prevent injury. And it's different from a golf pro in that they do a completely different job. What this golf assessment is, it takes a look at biomechanics specifically. So it's a separate entity completely than what a golf pro does if we're looking at golf assessment. So again, this one is a Back to Golf certified out of Pebble Beach. And a couple of things that we look at with a golf assessment would be, number one is posture. Number 2 would be range of motion. Range of motion would include both joint mobility and flexibility. Number 3 would be strength. Number 4 would be balance. Balance would include weight shift, proprioception, which is knowing where your body is in space without looking. So the first thing we're going to look at, we're going to take our golfer here who's most likely injured at this point but needs an assessment because he wants to get back to golf or he wants to improve his prevention of injury. He may want to improve his direction of his golf ball so that it goes in a straighter line. He may want to improve on his distance and how much power he gets out of that, or all of the above. So one of the things that we would take a look at would be posture. So I'm going to have him face that direction. And so when I'm looking at his side, I want to look, again, at a posture, and I'm speaking with physical therapists, on that plumb line. One of the big things that I'm going to take a look at in his posture, number 1, is how forward his head is and what kind of curves he has in his spine. We're looking for, of course, normal curvature in the spine. We want primarily the spine to rotate on an axis, and if his curves are too much, we lose the direction in which his ball goes, and we lose power. So every certain degrees off he is with flexion of the spine or too much extension of the spine, he again is going to lose what direction he wants that ball to go in, and it's not going to go as far as he wants it to. And then he may also injure himself, as well as, again, if his head is too far forward, he again is going to lock out some areas of his spine. So I'm going to have him face the front wall again, and now I'm going to take a look at just where his hips lie, where his toes are, if they're toeing out or if he's in a aligned position. I'm going to take a look at the dorsiflexion of his ankle or plantar flexion of his ankle, and does he have any mechanical issues possibly there that may limit the range of motion that he gets from his body. I'm going to take a look at the front and see where his ears are, where his, again, neck is, where his shoulders are, or one shoulder higher than the other, hips, knees, and again, ankles. So I'm going to come back over here. One of the things that I'm looking for with all these is mobility of the joints. To get a golf swing, and a golf swing is not, our body is not mechanically supposed to do 2 different directions at once, but we're going to need his or the golfer's entire body on one side to externally rotate or supinate or abduct, depending on what you're looking at, what joint you're looking at, while the other side internally rotates, pronates, or adducts. So I'm going to take a look at that next. So I'm going to come around front. I'm going to have him cross his arms in front. I'm going to have him unlock his knees. And I'm going to have him get into just a little bit of a golf position. It's okay if I'm, and looking at him from the front, I'm going to have him rotate back into a back swing. And I'm going to take a look at, so you can stop right there and you can hold that position if you would. I'm going to take a look at his foot. Is his foot pronating on one side, internally rotating at the tibia, internally rotating at the hip? What is his back doing? Is he excessively lordotic? Is he rotating in a nice, straight, stable axis? Or is he stealing from an area that he shouldn't be? Now I'm going to take a look also at his shoulder blade. Does one shoulder blade completely adduct or come around while the other one goes external? And I'm also looking at how his trunk is able to move on his neck. Again, what his eyes are doing, which is pretty good. Now I'm going to have him rotate to the other direction. And what we're doing today with this particular thing is we're not really assessing him, so we're not going to do an actual assessment. We're just showing what we're looking at on each person. So we see some things that I could fix with him, but we're just looking for the assessment today. Also on this side, now we're looking at does the other side pronate, and how much internal rotation does he have from one area versus the other? Is there too much in one area? What his spine is doing, his shoulder blades, and his neck on his head, okay? So I'm going to have him come back to the middle again. Now I'm going to have him do it again. I'm going to look at a couple different things. Your head's going to stay in front now, like you're looking down at the ball, and you can go ahead and rotate in the first direction that you did, and then back in the other direction. Good. So this, again, we're not doing an assessment on him today specifically, but this gives me an idea of things that we're looking for. So there's some sort of mobility issue up in his neck. We've got a mobility issue in his hips, and there's a mobility issue at his ankle. Right one greater than left one. So that's one of the things that we would look at. You can go ahead and drop your arms down. The next thing that I want to look at is balance. So I'm going to have you balance and stand on one leg with your knee soft and your hip soft, meaning a slight bend. Do not lock it back. And we're going to hold that. So yeah, toes are completely up on the other side. Eyes are up. Now I want to see what happens when I ask him to turn his head right and left. So you're going to turn your head right and left. You're going to do it 3 times. It's okay to touch. If you need to touch, you can. And it gives us an idea of how they're able to do that. Go ahead and put that foot down. One of the reasons why we do this balance test is essentially in backswing and then follow through, you're essentially on one leg. So somebody, whether they be younger or older, we need to be able to see, number one, can they weight shift all the way onto that side? And in a rotation, can they then balance on that one leg essentially? And what is their core looking like, and all the way up and down? So now let's go to the other leg, and we're going to take a look at that one. Soft knee, soft hip. You're going to stand in balance. Now I'm having him here, he's touching his hands together. We're going to allow that for today, but normally I wouldn't let him touch his hands together because that gives him stability. Now you can go ahead and look back and forth. Good. All right. So I might do that 3 times and have 3 trials, take best of 3 for between 15 seconds, 30 seconds, or depending on the age group, I may do it less than that. Okay. So now we're going to go up to your neck, and I'm just going to have you turn to one direction as far as you can, and to the other direction as far as you can. Good. I'm going to have you come back to the middle. You're going to put your hands across your chest, just soften your knees. You're going to go back to You're going to turn your head, your body on your head as far as you can in one direction. Okay. And then in the opposite direction. Okay, good. And then, so you can, say we weren't going to assess, but you can see where one side is really easy. He can move his body on his head very easily. The other direction, he wants to move his head with his body. So there's a little bit of a challenge there. The next thing we want to, you can drop your arms down. The next thing that we want to look at is the ability to have his shoulder blade come completely across his body on one side while coming directly into retraction on the other side. So we want full protraction, full retraction, and we want to see what kind of mobility the shoulder blades have, strength, stability, but also the shoulder joints. So let's have you, we're going to do this in two directions. I'm going to have you face forward, and I'm going to have you cross over. And so obviously through all these things, you can have people tell you if they have pain during these motions. Do you have pain during this motion? And then you can go ahead and switch to the other side. Okay. Good. And I'm going to look at that from the back so we can face you around this direction here. We'll let the camera see it. I'll look at it in the mirror. You're going to go ahead and do the same thing. Grab and pull. And then opposite side. Grab and pull. Okay. Good. Let's turn you around the front again. Okay. Now this time what I'm going to have you do is we're going to go back to that balance and that weight shift and add a little bit of golfing activity to it. So you're going to stand in balance on, pick a leg, any leg, soft knee, hands crossed over your chest. Now you're going to try to rotate as slowly and comfortably as you need to one side. And then back to the other side. Good. Put your foot down and take a rest. We're going to do the same thing while your head stays in front. Good. And then switch legs. And I'm just going to check that from different directions. So if you can do that one more time. I want to look at what the pelvis and spine does from the back. Okay. The next thing I want to take a look at is I'm going to go down the chain a little bit, and I want to see what the ankle can do. So keeping your heels flat and keeping your toes straight ahead, you're going to bring your knees over your toes as far as you can comfortably, keeping your heels flat. Good. Then come on back, and let's just do the left one only. Great. And let's do the right one only. Good. And come on back. All right. So, keeping in standing, I'm going to have you get into basically your golfer's position. Okay? And so what I'm going to take a look at is I'm going to take a look at, luckily we have a golfer on our hands, but I'm going to take a look at where is your weight shift through your feet, where is your feet positioned, what are your knees doing, are they locked back and out? What are your hips doing? Are they locked back and out? And what is your back doing? Really importantly here, again, we want the back to be in its natural, normal curvature so that when you have this rotation, it's fully through the axis of the spine, and a lot of the rotation is coming from the hip joints. If you don't have mobility in the hip joints, we can take it from some other areas, whether it be ankle or whether it be shoulder blades. So we might be able to increase the mobility through the ankle, through the shoulder blades, through the hips, of course. That's where we're going to get most of our mobility from. And then again, we might be able to get a little bit more motion through the back if the back is not in a good position. If the back is bent over, if it's too excessively arched, we can correct that to get more of the mobility and the motion from where we need it to go into. So now I'm going to take a look and have you go ahead and do a full backswing and hold it. Okay. Here I'm looking at everything that we talked about before. What's the ankle doing on the left side? Is it pronating? Do we have tibial internal rotation? Are we internally rotating at the hip? Same thing on the opposite side. Do we have supination through the ankle? Do we have external rotation through the tibia, through the hip? What's the pelvis doing? What's the spine doing? Everybody has a tiny little bit differences through their golf swing, but is he side bending to get himself back versus rotating? So I want to really take a look at that. Do I need to get a little more hip rotation from him so that he can rotate back and not have to side bend and twist from the spine? I'm going to also take, you doing okay? I'm going to also take a look at what his shoulder blade is doing on the right, what his shoulder blade is doing on the left. I'm looking at his hands and I'm looking at his neck. Is he completely forward? Is his neck and head completely being pushed forward? Is he back in, I'm going to come to the side, is he back in almost full extension with his neck, and how is he getting forward on the ball? Is he dropping his nose down at the ball, or is he shooting his head forward? So I have a lot of things that I can look at here. And then, great job, thank you. I'm going to have you go ahead and do your backswing, go completely to the other direction. And I'm just looking at the exact things here as well, but from the opposite side. Everything that I spoke about on one side should now be reversed on the other side. And those are the things that I can take a look at. You can go ahead and relax. And what I can do from all that information in this position is take everything that's lacking. Where are we lacking in the ankle? Where are we lacking in the knee, in the hip, in the core, shoulder blades, neck, posture? What do I think is then strength-based, balance-based, or joint mobility based? You can also, of course, look at flexibility, but a lot of times we're going to get our increased flexibility if we get our increased joint mobility. So at this point, I'm going to go ahead and have him lay down. So if I see big strength deficits or joint mobility deficits in the functional position, I would certainly take a look at them and can assess them in a non-functional or a kind of open chain position. Certainly this is something that can be done first. Depending on time, one might just can do the functional assessment because that's how bodies move. So if I saw something that appeared like it was going to be an issue, or if somebody is, again, rehabilitating from an issue, a joint replacement, a joint surgery, any kind of orthopedic issue, that they may still have some strength deficits, I'm certainly going to get an idea strength-wise where they may be able to get better and improve some of their weight shifting, balance, rotation through the trunk and the thoracic spine. Which is one thing that we didn't actually do in standing, is a trunk range of motion. So that is something that we could do as well. I've done these long enough that I kind of see where the deficit is, but if we're really splitting it apart, that's something that you take a look at separately. So here I'm just going to do a generalized screen of some of the muscle groups. So I'm going to have your toes come up towards you, and don't let me push you down. You're just going to hold it here. And I'm going to do eversion, hold here. Again, if it's an ankle issue, I'm going to do all of them, hold here. I'm going to have you hold here and hold here. Go ahead and pull back. Okay, so finding an area where there might be a strength deficit. One of the big areas that I want to look at pretty much on everybody, of course you're going to screen everything here, but is hip internal and external rotation. Hips are a big problem with any kind of golfer, because there's always going to be typically a limitation in hips somewhere. So go ahead and hold here, don't let me move you. And then as I do that, I can watch what his core is doing. Hold here, don't let me move you, so I can get an idea on if something's mobile up there. Go ahead and bring your knee up towards me. Hold here. And one more time, hold up, don't let me push you down. Okay, so we get some ideas. I'm going to go through a couple of strength screens during this, but for time, I'm not going to go through every single strength on him for this video. Internal, external, I want to always take a look at a lot of the rotators. So I want to look at, I want to look at ankle, internal, external. Basically, we're using internal and external for everything. Knee, hip, core. I can hold it here. Don't let me move you. Don't let me move you. I can make this more challenging depending on how much I need, but somebody that's younger, you don't necessarily need to do as much core work as somebody who may be older, although that's not across the board. So I am going to have you come out this way, a little bit in. Don't let me push you down here. Hold. Don't let me push you down here. Hold. Hold in here. Don't let me push you together, your hands together. Hold here. And I can also know if you have pain with any of these areas, let me know. Hold here. Don't let me push you out. One more time. Don't let me push you out. Good. I am going to take a look at some of the scapular stabilizers. I'm going to have your arm go straight out this way and palm up. Don't let me push you back. Hold here. One more time. Hold here. I'm looking for winging. Go ahead and drop down. And we're going to do this side. Out, hand straight. Don't let me push you back. Hold here. Hold here. Okay, so I'm mentally writing down some of the areas that I see some deficits in, any kind of scapular winging, any kind of forward motion to the shoulder, which is showing us that there may be some tight pecs where he might have trouble getting the scapula back and around. Okay, let's do two more mobility tests. One is going to be for neck. I can look a lot more at the shoulder, and I would specifically look down at posterior mob, anterior mob, inferior, superior, external rotation, all that, each side. If we did all of these on everyone, the golf assessment may take too long. So again, on each person, we kind of find where the mobility issues are, and then go in and take a look at the joint mobility for them. I am going to take a look at ankle mobility and a little range of motion of the neck and head laying down. So I'm going to have you lay down on your back. You can actually bring your head all the way up here. And hip, of course. We want to take a look at hip. So I'm just going to, I can do this without shoes on. For time's sake today, we're just going to leave shoes on. I'm looking for true mobility in the ankle, because I'm making a list now as I go of what I want to treat and how I want to get his golf game better, back on the course, and no injuries. I'm going to take a look at hip rotation here. I'm also taking a look at the pelvis. Is the pelvis moving with me, or is the pelvis stable when I move him around? I'll look at this side. External to internal. You're good. And then I can look at it from this perspective as well. As far as, again, this screen, we can make an argument that there's lots of different ways to check mobility, different tests, different things. For these, it's basically a screen. We find the area that there's a problem, and then we can go deeper and deeper into this. This is kind of a wide angle of everything today. So I'm going to have you spin yourself around. And head's going to be down this end, feet are going to be down that end. Probably going to have you take your hat off. Thank you. And then we're going to take a look at, again, neck mobility. If we found that there is a problem with neck mobility, where is that coming from? And we're just going to assess that. Again, we're not here today to show you how to assess neck issues specifically. We're just saying we need to assess where the lack of motion is coming from so that we know where to treat. Sometimes people coming into golf rehabilitation or golf assessment will just have one assessment and then one follow-up. So again, they're not here for complete treatment. That's another option as well, to have physical therapy for treating all of these issues. If Brian were to come to physical therapy specifically for golf rehabilitation and golf issues themselves, we would have some physical therapy that we could do on him to bring him to the best alignment and equilibrium for his golf game. All right. So you can go ahead and sit yourself back up. Great. So that was a quick, I know it wasn't that quick, but it was sort of a run through. This can kind of go on and on and on. A run through in regards to both assessment and golf rehabilitation. The assessment that we do here, I book an hour for the assessment and then a half an hour for a follow-up. What I would do with Brian here, if he was here just for one visit and a follow-up for that, is give him just one or two exercises to work on to increase his range of motion, his mobility, his strength, his balance, and again, his golf game, getting it so that he can have a little more power, a little more of balls straight where he wants it to go, where he thinks it's going, and then again, prevent some injuries for him. Golf rehabilitation, again, same kind of thing, but we could work with the physical therapist to work his program into more of a golf-based program. Any questions that anybody has on golf assessment or golf rehabilitation, please feel free to call me here. Again, my name is Allison Pike, and I hope that made some sense for everybody.